Hi, we are
Hi,
recording for Community Health, a project about home health nursing. My name is Carrie,
my name is Amila.
I'm Jennifer.
and today we'll be talking a little about the primary activities and different things that these home health nurses do. So first off, primary activities include many things such as wound care. Many of these patients are homebound and need help with their wound care and need dressing changes, so these nurses are responsible for that. As well as IV therapy. That's another skill that is needed. Some patients may need antibiotics and they may need fluids, so a patient would need the nurse to do that for them at home. Medication management is also important for these patients. Many need refills on their medications or need assistance taking them. Many of these patients may have trouble seeing and may not be able to organize their medications, so these nurses can do that, as well as help with coordinating with the pharmacy for refills. Assessment skills are very important for these nurses as well. They are generally the only person who may see this patient for a few days. So if anything new shows up, they have to be very good with their assessment skills to catch that and inform the doctor. They also work independently and perform their duties without supervision. Many of these nurses may have came from the hospital, so this environment would be different and they would need to be able to work by themselves and alone and not need that supervision they normally do. They must also be able to communicate well with their families and the patients. Many of these families depend on the home health nurse to tell them things that are going on and educate them. This can be a great help for them as well. And they also must supervise CNAs. If the CNA may be there to do bed baths and activities of daily living, the nurse can help supervise that. The scope of practice is also very important for these patients. For a nurse, for scope of practice, you're performing assessments, formulating a nursing care plan to make sure that you're following, educating patients, and making sure that referrals are sent to doctors for specialists. As far as teaching strategies go, these patients need to have good teaching so they understand how to take care of themselves appropriately. So demonstrations such as teaching them how to give insulin shots is very important. If you have a pediatric patient, games would also be another option of how to teach this patient. Printed materials is good to give to the patient and for the family members as well. They may not be present while the home health nurse is there, but when they come home later, the family can read the materials and still understand what's going on with the patient. Simulation is another good option for a teaching strategy as well. So for learning strategies, it's important to know how our patients learn in order to teach them correctly. So demonstrating in front of them and then having them demonstrate back for you how to do a skill is very important. And then involving the family in a small group teaching setting will also help to ensure that everyone understands how to best care for the patient.
Okay, so how do you become a home health nurse? You first have to complete a 2-year associate degree in nursing or a 4-year bachelor degree in nursing. After that, you have to complete the NCLEX examination and work as a registered nurse. To specialize in home health nursing, you have to first decide if home health nursing is something you want to pursue. If you're unsure if you want to do that, you can do some volunteer work at first and see if it is the right path for you. If you decide that home health nursing is something you want to pursue in the long run, you can become a home healthcare clinic nurse specialist. To become a nurse specialist, you have to have a master's degree in nursing and take some specialized courses. Many healthcare professionals come together to help the patient at home. A registered nurse comes to the patient's home and helps them manage their illness or injury. They explain the post-treatment to the patient. They help the patient with diet and nutrition and exercise programs. They also help the patient with self-administration of medication. Home health aides come to the patient's home and help them with their daily activities. Physical therapists also can come to the patient's home and help them if they have difficulty with their moving and mobility in their environment. Same with occupational therapists. They can come to the patient's home and help them if they have difficulty conducting their daily living activities. If the patient has problems swallowing or has difficulty speaking, there's also speech language therapists who can come to the patient's home. Medical social workers can help the patient and the family find community resources in their neighborhood. Many healthcare professionals come together to help the patient at home and help the patient be more independent in their own environment.
We're going to talk about some necessary skills and abilities of the nurse. Most agencies require at least a year of previous nursing experience. They do prefer the experience come from a med surgical floor if possible. You can be either an LPN or an RN to be in home health. It just depends on your individual role. The LPNs work directly under the RNs, and the CNAs are side by side with the LPNs. The RNs usually do the first assessment within 24 hours of being accepted into home health. Now, these nurses are the intercollegiate part that are directly with the patients and in between the physicians, because these physicians aren't making house calls unless necessary. So these nurses must have strong physical assessment skills. They should be skilled with IV therapy and managing IV lines, from everything from venipuncture skills to actually mandating the lines. This does promote nurse autonomy, and these nurses usually prefer to work alone. Something important to remember, or an interesting fact, is that these home health nurses, they have autonomy and they have flexibility in their scheduling. This will be great for a young nurse family who needs flexibility with their scheduling, or just prefers to work part-time or as many hours as they want because of the flexibility. This is just a nurse in her car and her doctor papers in the trunk. I mean, the possibilities are endless. We included our list of references in this. And that is the end of our show. We hope you enjoyed it.
Thanks.